What does ABA therapy look like? Agencies that provide ABA-based services in the home setting are more likely to implement ABA services similarly than doing the same exact protocols or procedures. Regardless, an ABA agency under the guidance of a board-certified behavior analyst follows the same research-based theories to guide treatment other acceptable ABA agencies use. ABA-based services start with a functional behavior assessment, FBA. In a nutshell, a FBA assesses why the behaviors may be happening in the first place. From there, the FBA will also determine the best way to address the difficulties using tactics that have been proven effective over time with a focus on behavioral replacement versus simple elimination of a problem behavior. The FBA will also have recommendations for other relevant skills/behaviors to be taught and parent skills that can be taught in a parent training format, to name a few. From there, the intensity of the ABA-based services is determined, again, based on the clinical needs of your child. The completed FBA is then submitted to the funding source for approval. One-on-one sessions between a behavior technician and your child will start once services are approved. The duration per session and the frequency of these sessions per week/month will all depend on how many hours your child's ABA services have been approved for. Usually, this will be the number recommended in the FBA. The sessions are used to teach identified skills/behaviors via effective teaching procedures. Another aspect of ABA-based services in the home setting is parent training. Parent training can take many forms depending on what goals have been established during the FBA process. The number of hours dedicated for parent training is also variable and solely depends on the clinical need for it. If a one-to-one session is between a behavior technician and your child, a parent training session or appointment is between you and the case supervisor and with and without your child present, depending on the parent goals identified. Parent training services goal is for you to be able to have ample skills/knowledge in order for you to become more effective in addressing behavioral difficulties as they occur outside of scheduled ABA sessions. Depending on the goals established, you may be required to participate in your child's one-to-one sessions. These participations are a good way for you to practice what you have learned from the case supervisor while at the same time having the behavior technician available to you to give you feedback as you practice on those new skills. As mentioned in the beginning, no two ABA agencies will do the same exact thing when it comes to providing ABA services. However, good agencies will always base their practice on the same empirically proven procedures.